This is an article that came out in the Panama City News Herald, and it is dated November 18th, 2017. Report staggering drug deaths in Florida. And this one is kind of focusing more on Tallahassee, ladies and gentlemen. A highly anticipated report from Florida's medical examiners show dramatic increases in all types of drug-related deaths, including 97% increase in deaths caused by the synthetic opioid fentanyl. The report released Wednesday found that the total number of drug-related deaths in Florida jumped 22% from 2015 to 2016. The number of opioid-related deaths, 57,025 in 2016, grew by 35%. Opioids were either the cause of death or were present in the decedents, according to the report. Clearly, those are shocking numbers, and we have got to do something about it. And this is the Senate Health Policy Chairwoman, Dana Young. Even more troubling, medical examiners reported that death-related of all kinds of drugs, prescription drugs, such as oxycodone, and street drugs like heroin and cocaine, and alcohol were on the rise. And doctors and experts say the numbers of drug-related deaths are even more dire than the data in the report reflects. The report comes as lawmakers wrestle with how to cope with the nationwide opioid plague that has gripped Florida and prompt Governor Rick Scott and Donald Trump to label a public health crisis, but they don't like that. They wanted this to be a national emergency, and Trump would not do it. Prescription drugs killed more Floridians than street drugs, such as heroin. In 2016, medical examiners reported oxycodone caused deaths increased by 28%. The report said 3,550 people died with at least one prescription drug in their system that was identified as the cause of death, a 40% jump from 2015. The report notes that the drugs may have been mixed with other drugs and or alcohol. Also, of note in the report was the number of controlled substances prescribed statewide. Bay and surrounding counties are also the highest number of prescriptions in several categories. Holmes, Washington, and Bay in the Panhandle region were among the highest in prescribing of opioids, and sleeping pills, which I'm not surprised. That seems to be going hand in hand in the country. Given the CDC indication that opioids and sleeping pills represent a high-risk drug combination, and prescribing trends and patterns in these counties may deserve further examination. Deaths due to fentanyl, a lethal synthetic opioid analgesic, often mixed with heroin, spiked by 97% in a year, causing 1,390 deaths in 2016. According to the report, Manatee County saw the highest incidence of deaths due to fentanyl analogs, synthetic drugs similar to fentanyl but much more potent, with more than 25 deaths per 100,000 residents. The drugs that caused the most deaths were cocaine, the sleeping pills, the fentanyl, the morphine, the fentanyl analog, the heroin, alcohol, oxycodone, methadone, methamphetamines. The presence of methamphetamines in decedents spiked by 103%. Wow! Woo, man, that's a big spike. The report also showed the number of heroin-related deaths have spiked dramatically since 2011, when lawmakers cracked down on prescription pill mills. Over a decade, Florida saw more than a tenfold increase in heroin-related deaths. Now, that's a big jump. Now, I heard sixfold, but tenfold? Wow. But 96 in 2006 to 1,023 in 2016, with a dip as low as 56 in 2011. The year legislation aimed at shuttering the pill mills went into effect. The highest number of deaths were in the 35 to 50 age group. And the cause by cocaine, and deaths caused by cocaine, 1,769, jumped by 83%. Duval, Manatee, Palm Beach, and Monroe counties saw the greatest number of deaths due to cocaine. And that's because they're mixing in the fentanyl with the cocaine. Senate Criminal and Civil Justice Appropriation Chair Jeff Brands called the number in the report staggering. Imagine if we had a plane crashing in the state every month. We would do everything we could to stop that. That's about the amount of people who are dying every month due to opioid addiction. We must put the same effort that we would put into a plane crash every month and stopping that into this opioid addiction. It's going to take all hands on deck, that all hands on deck talk, but that's not changing a thing. Overdose deaths and opioid addiction affects everyone in the state. And the solution starts with criminal justice reform, Brand said. We have to define success, and to me, success is not more incarcerations. Well, that seemed to be the solution to the crack epidemic. More incarcerations, mass incarceration. Just get them out of here, throw them in jail, right? It's less deaths, Brand said. That needs to be number one goal that the legislature has. We want less opioid deaths in Florida, and we'll do anything we can to focus on less deaths. Well, that's very nice. I wish you would have had that attitude during the crack epidemic. Perhaps more people would have sympathy at this point in time. But this is the article, ladies and gentlemen, and this is based on the Tallahassee area of Florida and the counties that are all around in that area. But please tell me what you think. Leave your comments and subscribe. And don't forget to hit on that notification bell. Peace, family.